In Ukraine, by law, all life-sustaining medicine must be provided by the state. However, due to corruption, tender processes held by the Ministry of Health were often won by private companies, which purchased drugs at an inflated price. As a result, Ukraine experienced shortages of medicines. So, in 2015, the government of Ukraine entrusted international organisations like the UNDP with the procurement and distribution of medicines. This UN agency's warehouse in Ukraine's capital, Kiev, is now full of life-saving drugs. From here, they're shipped to healthcare facilities throughout the country.
The minister told me that there are some laws that say this medicine had to be bought there, at that company, whatever happens. So we believe that engaging international organization like ours allows Ukraine to escape the old ways of doing things. And believe me, the old way of doing things was not good. People were not getting their medicine. Some of the medicine that we see in this warehouse and elsewhere are for the first time coming to Ukraine after 2-3 years.
Despite some challenges, the involvement of international organisations in the procurement process has already shown good results. The UNDP estimates its efforts have saved the government €3.7 million. When procurement was the sole responsibility of the Ministry of Health, only 45% of Ukrainian patients got the medicine they needed. The lack of TB vaccine, for example, resulted in an increase in the number of deaths, according to the head of the Kiev Region Tuberculosis Hospital.
It's really hard to treat those patients who are faced with shortages of the necessary medicines. Their condition can be unpredictable, and it may lead to a fatality.
For years, the organisation Patients of Ukraine campaigned with other groups to make medicines accessible for all. Now, transparent tenders increase the cost-effectiveness of medicine procurement in the country. The result is a significant saving overall. The savings we have are huge, she says. If we compare the prices at which the Ministry of Health bought medicines and the prices at which international organisations purchase the same drugs, we'll see that we've saved €32 million as a result of the reform. NGOs say the procurement process must not be placed back in the hands of the Ministry of Health. They're calling for an independent national medicine procurement agency instead.